My name is Joseph DeCook. I'm an obstetrician-gynecologist. I've been practicing that art since 1967. Probably in that length of time delivered over 4,000 babies. Generally, in America, about 1 out of every 4 pregnancies ends in abortion. When a patient comes in for a medical abortion, she's going to get some pills. First thing she's going to get is RU46. They're to take that pill immediately, and they're given another set of pills to take at home 2 days later. The original protocol would be to come back to the doctor and get those 2 pills, but that's been shortened for convenience to take it at home. So at home, 2 days later, they take the second set of pills. Now the first pill kills the placenta, kills the product, kills the baby. The second pill then cramps out the products of conception, cramps out the baby, and the abortion is over. Half the people will abort within 4 hours of taking the second pill. The other half are left to go home, bleed, cramp, bleed some more. For an average of 13 days is the average bleeding time for an RU46 abortion, although some women will bleed and spot and cramp for 30 days. The immediate risks with a medical so-called RU46 abortion would fall in the area of prolonged bleeding and infection. 7% of these women will require a D&C to complete their abortion. In other words, the medicine's not doing it alone. And that's if they're just early, like 7 weeks pregnant. If they're 8 weeks pregnant or 9 weeks pregnant, up to 25% will require an emergent D&C to stop severe bleeding. Before beginning an abortion procedure, some thought has to be given to pain relief. They will often use an instrument, a syringe with a needle, to give a paracervical block, which will block out some of the pain. In general, people are not given a general anesthetic because they're dangerous to general anesthetic. The suction curettage is the most common abortion procedure because most abortions are done in the first trimester. The suction curettage is quite simple. We use a speculum to open the vagina, get up to the cervix. The cervix is then dilated, oftentimes using an instrument something like this, or perhaps a graduated dilator, something like this in smaller and then larger sizes, to allow for opening of the cervix in order to get the suction curette in. The suction curette is then placed inside of the uterus, going through the cervix. The suction curette looks something like this, although usually they're twice this long, but they have a beveled edge, and they're placed up inside of the uterus, and then the suction is turned on. At this point, the products of conception are sucked into the tube and down into the bottle. As you get into the second and third term abortions, the risks become significantly more serious. They mainly would involve bleeding. When you're working inside of a uterus that's mid-trimester, say 15 weeks, 18 weeks, you're working inside an extremely vascular organ that will tear easily, that will bleed uncontrollably. And so instrumentation inside of this kind of organ is dangerous. The second type of surgical abortion is called D&E, dilatation and evacuation. The first thing that has to be done is to dilate the cervix, and this is done by putting in material into the cervix and leaving it for 24 hours. This absorbs water and dilates the cervix slowly. At that point, the patient comes in for the actual abortion procedure. She is brought to the operating table, put in the stirrups. The vagina is opened with the speculum, and you are now looking inside at the cervix. Looking at the cervix, then, the abortionist will take a ring forceps, reach in, grab hold of the cervix so that he has it firmly in hand. The laminaria material used to dilate the cervix is removed, and at that point, the abortionist will then remove the products of conception. The placenta is removed, often again with the ring forceps, and it is piecemeal removed. The procedure is over except for looking at the instrument table on which the parts have been assembled. It's essential to make sure that you have 2 arms, 2 legs, 1 body, and 1 head, or you've left something inside. And so that is a gristly part of the procedure that must be done to be sure that the dilatation and evacuation is complete. The DNX procedure, which is the partial birth abortion, is actually a fairly complex operation in the sense that it takes 3 days to accomplish. The first 2 days are dilating the cervix to a sufficient opening so that one can get their instruments inside to grasp the baby. Now, once the cervix has been dilated, and usually it starts on the first day by putting in 5 laminaria, and the second day putting in about 25, and laminaria are little things that absorb water and they spread, and so the cervix is slowly dilated. A partial birth abortion demands a leg first. You pull that leg down, you find the other leg and pull that down, and then you have the baby. You have a handle. And so you pull on the handle, and out comes the body and the arms, and now you're left with just the head. Now, the head is large. It's considerably larger than the rest of the baby. It won't come through the cervix. The way to solve that problem is simply make a hole in the head and suck the brain out, and then the head will collapse. The baby then delivers fairly easily. This is the partial birth abortion procedure. The placenta then comes out, possibly by itself with contractions. It may separate, or you may have to reach in with instruments and help to remove the placenta. The major danger with a partial birth abortion, again, when you're working inside of the uterus and you're trying to convert that baby to a breech to get the legs and you're instrumenting, it's a blind procedure. You cannot see what you're doing. You can only imagine what's going on in there, and you can tear the wall of the uterus, at which point you're going to have profuse bleeding, and an operation, usually a hysterectomy, will be required at that point. That's a major danger. The long-term effects seen post-abortion generally fall into about three categories. The psychological side effects are obvious, and the depression rates are at least doubled in the next 2 to 3 years. Substance abuse rates are doubled at least in many studies. The ultimate abuse from depression is going to be suicide, and actually the suicide rates for post-aborted women in several large studies show that they are between 3 and 6 times higher than women who chose to deliver their baby. In the long term, it's going to be healthier for the woman to carry the child and to abort.
If you're struggling with an unplanned pregnancy, you're not alone. There are people and resources that can help. Call 1-800-395-HELP. There's more out there than you think.